Actually, it gives me great pleasure. Area Agency on Aging 1B. We have an update. This will be a receive and file, but it gives me great pleasure to present the new CEO that took over in October of last year, Mr. Michael Karson. Michael?
Thank you very much. It's a pleasure to be here. I'm hoping that the impact hammers don't rely on me as well. Just want to give you some brief overview, and then I'll open to questions, of course. Just want to mention the fiscal year 2017, $10,942,000, along with $55,000 from Macomb County, went into this county to support our programs. And of that, 7,560 seniors and caregivers received information and referrals from our assistance program, while 15,000 seniors 60 or older were helped by almost 2 million units of in-home and community-based services. Meals, home-delivered meals, 410,000. And we were able to work with 258 nursing home eligible patients that were part of our My Choice or Medicaid program that saved the Medicaid program in the state just over $10 million. The population in Macomb County is obviously growing. 16 people every day turn 60 years or older. And we expect that by 2020, 222,000 residents in Macomb County will be of that age. And we are great partners, and you guys are great partners with us. It's an amazing county, and obviously a senior population that is growing. So we look forward to a good future together and supporting any way that we can the programs and initiatives from the county and now the programs that we have to bring forward. So I'd like to thank you, and I'm here for questions.
Thank you very much. Let's start with, is there a motion to receive and file?
So moved.
We have a motion by Toko, support by Drollet. I thought it was very, very important to have Mr. Karson come here and give us a bit of an update on AAA 1B. We rely on, Macomb County relies on AAA 1B, and the amount of counties and the amount of people and the amount of programs that they administer is really pretty mind-boggling. And I think it's important that we all see and have an open line of communication with Mr. Karson, who, like I said, just became the CEO of AAA 1B. Commissioner Chairman Smith.
Mm-hmm.
Thank you, Chairman. Welcome to Macomb County. I was writing a few things when you started, so forgive me if you gave us a little bit of this, but can you give us a little of your background?
Sure. I grew up in the nursing home business. I'll give you the whole background.
There you go.
When my youngest brother went off to school full time, my mother got a job in a nursing home and ended up buying nursing homes and owned about 8 of them before selling out to a national company. So I grew up painting nursing homes, cutting the grass, mopping floors. I was really good at polishing them as well. So I had a good background there. I became an administrator and ran a bunch of nursing homes as the regional for the parents or the family's company before moving on. And then from there, left the business for about a year or so, but then came back and I ran a 312-bed psych building. So I did that for 10 years before going in with partnerships and owning 2 of my own assisted livings, and those were in Wayne County. And then from there, working with Brookdale, and from Brookdale, I had a territory from near the Ohio border all the way up to Midland. And then I went to Henry Ford Health System, where I worked as the director of the PACE program, which is basically a support program for people that are living in the community that need nursing home level of care. So did that for a number of years and extended the program into this county, as well as we were in Wayne County and then into Oakland as well. And then from there, I went to HAP. It was a kind of a lateral move to help start the demonstration program, which is the dual demonstration, or My Health Link, which is Medicare, Medicaid, and then of course the states are working with the healthcare providers like Aetna, Blue Cross, different companies that come together to provide services. So I did that and recruited out of there. I went to Chicago for 3 years, and in Chicago I worked for United Healthcare, and I was in charge of complex care management within the state, and I had other programs as well. I did that for 3 years, and this job was available. I was told by one of the people in charge in Detroit at the Detroit AAA, and I started calling until I found a board member who would talk to me. And I drove that person crazy until I applied. Went through the interview process, moved back to Michigan where I had a house the whole time for my adult kids who were both in school. And I'm back. I've been here now. Today is my 6-month anniversary, and I'm glad to be here. It's an amazing program. It's a dream come true for me to work for AAA. It's the first time in my career that I've been able to partner with people that used to be competitors, to bring people to the table and work together to see what we can do to benefit seniors and adults with disabilities within our community. The programs are complex. The money sources are extremely complex. We get dollars from the federal government, the state government. We have different programs and different requirements for each program. One program alone, My Choice, which is a Medicaid program that keeps people that have a nursing home level of care in their home, has over 4,000 regulations. And these programs are extremely complex. The money situation is always challenging. One program, whatever money we get in, has to pass through. Other programs have a potential to keep a little extra dollars for rainy day. But in doing so and learning about it, it's been a great opportunity to reach out to people I know in the industry and to work together with them, collaborate with them, and in doing so, seeing what we can do to help seniors. Mr. Smith and I were talking prior to the meeting, and one of the things I was saying is that there's a real gap of care for the people that have the dollars to care for themselves, whether they have Alzheimer's, dementia, or need additional services. There's a lot of places out there that will take $3,000 to $5,000, $6,000 a month to care for you. There are a few Medicaid nursing homes, but not many. And when then you look in between, what do you do with everybody else in our population that is aging that will need additional care and services? You go to a nursing home, and nursing homes are basically benefit by getting you out as fast as they can and then avoiding the hospitalization. So if you go for rehab, they'll give you rehab for 10 or 15 days for a hip or a shoulder. Then they're going to send you back in the community. Then someone's going to try to support you so you don't go back in the hospital within 30 days for the same diagnosis because there's penalties. But then what do you do after that? So we have so many seniors that are living at home, or seniors that need services, or seniors that will need some type of institutional care. They can't afford it. So there's a tremendous need, and that need will just continue to increase. Our Meals on Wheels, those requests are coming in all the time, and we have a waiting list. So we're trying to look at our dollars and what dollars we can allocate towards that to help feed people. There's real questions with people being compliant with medication, people having isolation who are living in facilities or living in homes by themselves. We have a program called NIFTY, and NIFTY is a program where we go into nursing homes and see who can be repatriated out of those nursing homes that want to go back in the community. But I've come into some areas where I'm concerned because people that are leaving the nursing homes, one in particular, an elderly female, she's wheelchair bound, she has a PEG tube, which means she has a tube into her stomach where she's fed. She's in a lower level apartment with stairs leading up. She's in that apartment by herself. Nurses will go in there 3 times a day to feed her and to put medications through her tube and pass it with a bolus amount of fluid to push it through. But at the end of the day, who's visiting her? Her socialization is zero. It's really the caregivers that are the only ones that she sees that come to see her. That's not an ideal situation, and so many people are like that. The care is needed. The need is amazingly great, and I'm hoping that while I'm here and partnering with everyone in the counties that we serve, we can try to figure out solutions to these problems.
Great, thank you.
Thank you.
Thank you very much. If you can, share which counties that AAA 1B services.
Sure, I'll start from the south because I have this really figured out really well. Monroe, Washtenaw, Livingston, Oakland, Macomb, and St. Clair. So we surround Wayne County. Wayne County used to be one large area agency on aging, and then at the time that Coleman Young was the mayor, he went to Lansing and fought very hard for Detroit to be separated. So Detroit is separated as their own service area, and then all of Wayne County is then served by Senior Alliance, which is another agency with a different name that handles Western Wayne and Southern Wayne County.
All right. Any other, this is, the population served is tremendous, and the need never ends. But that being said, any other comments or questions? Hearing and seeing none. Michael, thank you very much for coming here and for your presentation. I appreciate
the
it.
opportunity. Thank you, and I'm available anytime. I look forward to seeing and getting to know everyone better. And
Thank
good
you.
luck when you get home with that report card.
Thank you. Please vote.
It's just taking a second to register. So when you hit
Oh
save,
my
you gotta-
God, it actually worked.